Nursing homes are hotspots for COVID-19, but the risk of infection does not stop at the residents. A former nurse's aide describes her line of work as the most dangerous job in the country.
Studying that risk is a group you might not imagine working together, healthcare experts and designers.
A collaboration at UT's Dell Medical School has these researchers coming up with creative solutions to stop the spread of COVID-19 among the most vulnerable Texans in nursing homes. KXAN investigator Avery Travis covers their first round of findings presented to City Council today.
I was the only CNA for 26 residents.
30 years later, Lori Porter says not much has changed since her first night as a certified nurse aide.
There was a pandemic in nursing homes long before there was a virus pandemic. There was a pandemic of too low a pay, horrible image.
That's why researchers at the Design Institute for Health at Dell Med are working to redesign the system as a whole, improving workflows for staff and quality of care for residents.
The researchers interviewed nearly 50 staff inside 4 of Travis County's 31 homes, where around 3,000 residents live, but nearly 5,000 staffers work.
There wasn't a facility we visited where there weren't a half dozen hero stories of staff making really incredible sacrifices in their own personal lives to ensure the safety of residents.
Porter agrees. She co-authored a piece for the Washington Post this week calling it the most dangerous job in America, where staff member deaths are on pace to double the rate of last year's deadliest occupations, logging and commercial fishing.
Well, the average CNA doesn't make $600 a week working full time, holding lives in the palms of their hands.
The team looked at how dining rooms have been arranged, how PPE is being stored, and which spaces still allow for person-to-person interaction, like nurses' stations. Chang also noted a disconnect between infection prevention protocols and the realities of the job.
I didn't meet a single certified nurse assistant who said, I can practice at a safe distance of 6 feet. If I'm going to dress, bathe, feed a patient, I'm going to be in contact with them.
Evaluating the industry from a design perspective, they hope to find more creative solutions. Avery Travis, KXAN investigates.
Chang said the second phase out of 5 begins this week. They will take a closer look at the problems they identified in phase 1. They also want to expand their research to assisted living homes and nursing homes in other parts of the city like South and East Austin.
This research comes just one day after the state released the names of facilities that have had COVID-19 outbreaks. KXAN investigators have been fighting for the data for months, but in today's council work session, Austin Public Health said it could not release that same information locally because of a ruling from the Attorney General. Council members Leslie Poole and Ann Kitchen urged the city's legal department to reevaluate this in order to be more transparent.